done before? Yes, okay. Do you have any pain right now? No, she's not, doesn't have any pain. So we're gonna go ahead and proceed, okay? So hand hygiene, always even before you walk into the room, hand hygiene. So with hand hygiene, let's say we have our things here. So hand hygiene, and I'm gonna go ahead and get some clean gloves. But before I even put these on, I'm gonna start opening some of my packages. This one, because I know I'm gonna need a red bag, I know I'm gonna open this, and just like everything, when you were taught sterility, you're gonna open outward and away. What else am I gonna need right this moment? I think probably just my red bag. So I'm gonna go ahead and put my gloves on, and I already hand sanitize at the same time. Did my hand hygiene. Take this out. I think in the video they didn't wear gloves when they were doing this.
When they put the bag, no, I don't think so.
Okay, so they're gonna go ahead and sift this, because remember, these wounds have drainage sometimes, they have blood, so it has to go in a red bag. You don't have to put all the trash in the red bag, just the stuff that's soiled. We have to gently remove the tape and explain to Ivana, I'm taking the tape off now, okay? You might feel a little bit of discomfort. If this seems to have some drainage outward and it seems like it might be stuck on her skin, you may want to pour a little bit, but usually you don't know that until you take this off. And then you'll notice there, if it looks dry, you might want to just grab a little bit of saline. Grab a little bit of saline and just pour it over to loosen it, some of it up, because it's painful to get stuff and you just rip it right out. So we're going to take this off, and as we're taking this off, we're looking to see what we see, the drainage, what does it look like, the odor, and we're going to be looking at our wound. Now once we have that exposed, now I can, if it needs to be irrigated, I would irrigate at this time. I would have the patient roll to the side. I would put a wipe here that will collect, because I don't want to wet the entire bed, and I would also put like a basin to collect, and I would irrigate and have the drainage fall forward. This case, this wound actually is small. We have some of the mannequins that the wound is much bigger. So in her case, you know, I'm going to assess around the side, check for any worm. Look inside. I notice that there's some tunneling. So I'm going to measure that, and if you know that there's tunneling, you immediately know you have to grab a Q-tip, because you're going to have to see how deep that tunnel goes. This specific patient has 2, and remember, tunneling is a hole, like a tunnel, and then undermining is anything under the skin. All that has to be measured. So I'm going to go ahead and measure it, and I had some Q-tips that I already had opened, and I'm going to measure. I'm going to measure clockwise. So you're going to, this one here measures 6 inches. Measures 2.5 inches, and the time is from 12 to 6, and then go across. Measure. So I'm going to go ahead and do all my measurements outside first, and then when you have to measure inside, you're going to check your undermining. So this is undermining. Check here. Here you really need to be specific as your clock. So what time would that be here? How would you document that?
8 o'clock.
7. Yeah. So you'd say that at 7 o'clock we have undermining. That's about 1 inch. So you would do that for all the undermining. Then you go back and look at your tunnels and do the same. And this tunnel here, that's close to, let's say, 9 o'clock. You measure. It's about another inch. And you would do your full measurements, okay? Then since we did touch the dirty and bloody stuff, you put out on your red. So we did all our measurements. We're gonna go ahead and remove my old gloves. I'm gonna wash my hands, and now I'm gonna start preparing my sterile field, okay? See how this one has a bigger? So it just depends on which one you get. So I'm gonna hand sanitize, wash my hands, and start opening my sterile field. And loosen that. I need some 4x4s. And I had this here in case I needed to irrigate, but in our case, the wound looked okay. We don't need to irrigate. We'll move that out the way. Let me open my gloves. because I still need to touch some things in my package here, I'm going to only put one glove on because I want to touch things in, but I also have to touch unsterile things. So one hand will be gloved, one hand will not be gloved. The hand that's ungloved will be the one that's going to be touching the stuff that's closed, or the other one that's sterile is going to touch all your sterile stuff, okay? Well, one important thing I have to tell you guys, make sure you lift this up to your height of comfort. I think maybe it's on your side. Mine is just doing the head. Because you don't want to be bending down too much. That's, we do check for making sure you're doing procedures in a comfortable manner. I'm going to do one glove first. This is sometimes the tricky part for some of you. If I had both right now, it'd be easy. But I can only do one, so I want to make sure I do this right. There we go. Okay. So I decided to make this my sterile hand, so I can put this glove on the side for now. You can always touch in here because that's sterile. So what I'm going to do is I'm going to grab a few of these, and I'm going to put those here. And now I need to wet some. Make sure you're not going over your sterile field. And let's say this was a new bottle. I do want to dump some of it out, and then I would date it and time it. Pour some into my gauze. Close that up. And before you put your next sterile glove, just check your area. Make sure you're not going to need anything else, because now you're going to be considered sterile. Okay, so I think we're okay. Put my next glove on. Okay, good. Alright, so these are my wet ones. So the very first thing that I'm going to do now is I'm going to open this to one layer. I'm going to squeeze the excess because it is going to have quite a bit. So I'm going to open it up. So I'm down to one layer here. I'm going to grab my thumbs and I'm going to start packing. Okay. You want to grab it in your hand where it's not going to be flopping around, because you want this as sterile as possibly can. So here I'm going to start packing. Our wound is not that big. Some of the mannequins will require more, but this one was good enough.
So do you pack all the way down into the tunneling?
You can. If sometimes with the tunneling, they'll have a special, like an iodophore that they'll want you to put. For this case, for demonstration purposes, we're not. We're just going to do the simple one to dry. But that is very possible that you will have that.
Do we clean at all before we pack in, or just?
You would have observed already. We said for this patient he was clean, so we didn't have to irrigate or clean. But if you look and there's some eschar and there's a lot of drainage that does look, then you can have two options. One, you can do the irrigation and then get a gauze and kind of clean around very gently. So those are options. So it just depends. If you happen to get the bigger wounds, it's up to you on demonstration what you want to tell me, or I may give you a scenario and say, okay, this patient, this is what you see. Then you would tell me what you would do.
Okay. So the cleaning is just with the clean glove. I mean, the cleaning is just with the clean gloves, right? Not sterile gloves.
Yeah. Correct. Yes. Okay. So this is now my dry. I would come in and get mine. And once you get up to this point, you really, sterility doesn't matter anymore. The sterility was more important when you're packing the wound. Once you're done and you put this, you can do one of two things. You can take off your sterile gloves, clean your hands, because we were there, clean your hands, and then put regular, or I'm completely okay if you want to work with tape without gloves, because you're closed. So that one's up to you, okay? Because gloves and tape is unfriendly, or you can also cut this ahead of time. So, and you can do all 4 borders. Normally I would have used gloves for this portion.
Can you keep on your sterile gloves, or do you need to take those off and get?
You can keep your sterile gloves.
Okay.
If they're not all soiled, you can keep them on. And it's up to you. I'm not picky about that part.
Because in the videos, you see them like take off their gloves just to like throw away, put on clean gloves just to throw away the trash.
Yeah,
and,
because
like,
that's dirty. Because if I'm grabbing all this, that's why I said normally in the hospital I would have put on regular clean gloves. You're gonna date, initial, and you're gonna go document. So you're gonna document patient tolerance, what you saw, how much exudate, the measurements, and before you leave, you're gonna position your patient for comfort, give them the call light, do all your safety measures, put the bed back down, give them the call light, and come back and check on your patient after. Okay, and of course wash hands before you leave your room, and pick up your mess. And since it was kind of a messy wound, if it was a messy wound, you have to put your plain gloves on and clean your mess up. Okay? Any questions? It's actually pretty simple if you've done this before. It's just remembering your step by step.
Do we have all the stuff that you want us to have ready here?
It's in your kit. Yeah. And we have other things for you. You can either use this ruler too to measure your tunneling, but this one has measurements too. So if you, when you check off, you have to bring this with you. This is not in your kit. So certain things you do have to grab from our supply. Q-tips are not in your kit. Okay. If you want to pack with Q-tip, that's okay with me too. But remember, if you're going to pack with this, then you have to open this sterilely and keep it open sterilely. It's kind of hard. That's why I ended up just using this. Because it is kind of hard to try to, unless you open a sterile field, which you can do that as well. You can open this and create a sterile field for yourself. You know, so clean the table first. And if you make the sterile field, then you can put stuff on here and you can use that as well. Okay? So whatever you're comfortable with, as long as you follow these steps, everything else is up to you, okay? Because some of you have done this before, so whatever you're comfortable doing, I'm okay with that. I think the most important thing is keeping the sterility and going through the steps of making sure we explain the procedure. You know, those little things, that fundamental stuff. And keeping, if you're not good with sterile gloves, practice. You have gloves there for you.
So when you check off as like it's in front of everybody.
No.
No? It's just one
You can tell me, you know, Professor, I'm ready to check off, and just bring this checkoff sheet, bring it with you, and bring a skills rubric. Okay? And I'll tell you what your score is. I have your score populated by the time you're done. Okay? You guys good? So practice. You got the rest of the class to practice.